So when you actually launch into having a goals of care conversation, there's two little skills that can be really handy. The first one is ask, tell, ask, and the second is responding to emotion. So Chris, the first ask is to actually check in where the patient is, and it's probably the most important part of the conversation. So ask them where they think things are at, ask them how they think the future looks or what it all means, and also ask them if now's a good time to talk about things, because it may be that they want somebody else there or that they're actually not ready right now. So ask all of that and do some finding out for information before you get on to the next step.
When you think that they're actually clear about what they want to ask and they're ready to be given some information, and the next part is to tell them some of the information. The important parts are to keep the information brief, avoid using medical jargon, and only give a maximum of 3 pieces of information. If you're actually going to impart bad news, it's probably best to just give one small piece of information and then wait. It's highly likely that the patient will have an emotional reaction. You just need to notice that, stop, and wait until they're ready.
That's right. And once you've noticed an emotion and you've stopped, it's really good to respond to that by naming it up for them. So it may be that you say something like, this has been a really tough time, or this has all been, huge for you, or it sounds like it was really overwhelming when you got all that information. This helps them just sit with the emotion, gets them over the hump, and then gets them ready to take on more information. Because when we're emotional, it's very difficult to take anything else on board. So name it up before you get started on the third part.
And usually you'll know when the patient's actually got to that stage. They'll usually take a deep breath or a sigh. They'll re-engage you by looking you in the eyes. And they may well say, what do we do now? What happens next? And at that stage, you can do the third part, which is to ask them once again if they've understood everything you've said, if they have any further questions, where they would like to go from there.
So use those 2 little skills, ask, tell, ask, and then naming the emotion when it arises to help get you through your goals of care conversation.